welcome back to Viewpoint. Tonight, taking an in-depth look at Operation Freedom, the GHA's vaccination programme. We're speaking to the Health Minister, the Medical Director, the Director of Public Health and the Director of Nursing and Ambulance Services.
As you know, we set up the GHA Vaccination Centre initially to vaccinate all our essential workers and frontline health workers, but we included as well all essential services, police, fire and all the other essential services, as in ambulance and everything else. We were literally given a brief to set this up in like 48 hours. Initially, all vaccinations were going to be done in the old primary care centre. But obviously, to safeguard public and especially the elderly members of our community, we decided to bring the essential workers part down here into St Bernard's.
Once you've received your questionnaire from reception, you come in and this is the waiting area before actually having the injection.
Yeah, literally members of the public, members of staff will come here, and as you see, someone will greet them once they reach this area. They'll ask them for their questionnaire and they'll ask you some questions pertaining to the questionnaire itself. So it's just to reinforce safety, basically. Things like if you're allergic to any known medication, if it's your second dose, whether you've had any type of reaction to the first one, and just to ensure that the credentials on the form match with the person that's coming through.
So today is not a clinical day, but there would be, on a day where you are giving vaccines to frontline workers, there'd be a queue of them waiting here to be called in.
That's right. We cohort them in batches, obviously enforcing the rules of social distancing and obviously infection control. And we'll have 4 or 5 people distanced here, and as I say, someone will greet you, they'll go through the preliminary questions, but those are reinforced later on by the nurse who vaccinates you. Okay. Would you like to follow me? You're here on station number 7.
Okay. So that's my questionnaire. You know that I don't have any allergies or...
No, you don't have allergies. We'll ask you to take a seat here, which is a disinfected bed with a clean paper towel on the top. Your nurse will be here with you. She'll introduce herself and then she'll run through the questionnaire again with you, asking you the same questions just to reinforce the details. Any allergies, any adverse reactions, and obviously which arm you would prefer as well. The advice we normally give people is that if they come with a short t-shirt or something underneath, but there is some privacy screens if anybody needs to undress or whatever, we put the privacy screens around the person.
Okay.
So your assigned nurse, once she's run through the questionnaire with you again, would ask you which arm you'd prefer, obviously, and should have her preloaded vaccine syringes here in her aseptic sterile tray. And then what she'd do is she'd go ahead and administer the vaccine.
I think the evidence is that the virus didn't become more lethal, it just became more infectious, and we still haven't got all the genomic data. We've been regularly sending samples to the UK for genomic analysis. That's the actual genetic makeup, and from the genetic makeup it's a bit like the stripes on your cat or the spots on a leopard. It tells you if anything is related to anything else. So I've only really got information back till middle of November. We did have one variant of concern, the Kent variant that people are talking about, that had come in, but we saw no further distribution from that particular case. But that's not to say that it couldn't have happened, and in fact we're in the process of seeing if we can develop our own capability to do that, because 2 months is a little bit too late to be able to find out. I think it was a mixture of a more virulent strain and a mixture of that with our desire to have our festivities. I make no bones about it. People let down their guards. It wasn't real. It was something that they didn't want to miss. They did the kissing, all the things I said that we shouldn't do. We let down our guard. We did it all, and therefore, unfortunately, the consequences were predictable and they were foreseeable. It makes my heart bleed that it happened, but You can only tell people. It's up to people themselves to choose what they want. And that's where the vaccines are incredibly helpful, because they provide another layer of protection.
Show us what the needle looks like, if you would, Sandy.
Okay, I'm going to unsheathe it.
You mentioned there that everything is already disinfected. I mean, to state the obvious, that's super important.
Yes, obviously any healthcare professional has a set of rules that they adhere to from an infection control perspective, but obviously administering the vaccine, any patient contact, there's always those additional precautions that they have to adhere to as well.
Mm-hmm. And is that difficult when there's a really tight turnaround? Because, as you said, you're asking people to stick to their time slots, and really you're sort of getting through a fairly high number of people in a short space of time.
The staff that we have, who are the vaccinators, obviously have gone through a very strict protocol, additional training that goes from online training to hands-on, and encompasses everything from actually administering the vaccine to basic and advanced life support and how to deal with anaphylactic shock as well.
Okay.
And again, reinforcing the infection control principles. So that's something any healthcare professional, as I said before, adheres to, but there's that additional precaution that's taken now as well. Because we have to ensure we've got so many numbers of people coming through here, we strict adherence to that.
You've been kind enough to talk us through the process for anybody who hasn't been down here, and also for the purpose of documenting it for future reference. But to be clear, that there's no vaccine in there at the moment.
No, there's no vaccine. This is a sample syringe, obviously, just to show you what's going to be used, but there's no vaccine whatsoever that's been used.
The GHA has managed to administer thousands of vaccines without wasting a single dose.
It's very important that we don't waste it, so there's the additional precautions taken when we draw up the vaccine and when we administer it, because every dose counts, because it's one more person that's been vaccinated against COVID-19.
And you mentioned earlier the possibility of, or at least of being prepared in the case of a shock. Have you had any such adverse reactions?
We've had some slight reactions, but as I said, the clinical team here are here on site, well trained. The girls we've got here and the nurses administering the vaccine at the moment are used to that. They're the immunisation clinic nurses that we've brought here, so they're used to dealing with all types. But up to now, we haven't had any severe adverse reactions.
Let's suppose then, I'm not going to actually have a vaccine now, but should I have had one, what would be the next step?
Okay, once you've had your vaccine administered, the assigned nurse to you will run through if you have any severe, like flu-ish symptoms in the next 24-48 hours, should advise you on taking paracetamol, and if you needed any extra medical advice, to ring 111, and then should ask you to take a seat in the waiting area.
Okay, so I'll go and do that then, thank you.
Okay, so the nurse would walk you out basically to where our waiting area, sitting area is. We've got two separate waiting areas, so we distance people and ask you to take a seat for 15 to 20 minutes. There's always a nurse available outside just to check if you're feeling all right. They'll ask you a few questions, and once your 15-20 minutes are up and you're feeling okay, then you're free to go home.
We've got two population groups that concern us. One population group is the people that were in hospital. They were at the severe end of the spectrum. And we know that people who've been on ventilators and at the severe end of the spectrum can suffer some organ damage. And I think we're still recognising what that means and how much the body recovers. We don't have enough information on that. So we're watching that cohort, and there are studies going on worldwide looking at that group. There's a second cohort of population that really had minor disease. Sometimes it's not even been noticeable. And then they go on to develop something called long-haul COVID, long COVID that you've just mentioned. And that can range from a range of symptoms that look like the ME kind of phenomena where you've got muscle aches, you get extremely tired. But we know that evidence has indicated that you can see damage to the heart. I've seen pictures of damage to the brain. I've seen damage to the liver, the kidneys, and the most insidious issue is damage to the lining of the blood vessels that activates the coagulation system. Now, you know, when we cut, we bleed and it stops. That is a good thing, but when it's going off randomly in our body, that's a very bad thing. So you can see, and I know that we've had patients who've come here before, residents who've got mottling, skin mottling, for example. I know that you can get clots in the lung. I know that you can get clots in our leg. Gibraltarians have had all of these issues. And what we don't know at the moment is what the long consequences of that are. But I would advise your viewers, if you do have sluggish circulation or you are concerned about excessive tiredness after having COVID, maybe 2, 3, 4 weeks, please contact your GP, because I think it needs a review in case you are suffering more longer term chronic consequence. We don't know enough about this disease, and we've just had 3,000 people who've been infected from December onwards. Those 3,000 people, I think, need and merit some follow-up. Just because you weren't admitted to hospital doesn't mean that nothing bad will happen, and we don't want anything bad to happen. That's why the best thing that people can do is to contact their GP if they're worried. It may be nothing that they particularly need to be worried about, but I don't want people to think that there's nothing wrong with them.
I couldn't get up. It was just, like I said, fever, headaches, sore throat, terrible, that tickle sort of cough, and you keep on coughing all the time, and your brain, like, it's terrible sensation, sweating and shivering, cold. It's terrible. The breathing was okay at the beginning. It was probably after 8-9 days when contact tracing extended my 10 days isolation to 5 more. So basically they isolated me for 15 days. And in those, 6-7 days, everything changed. I couldn't walk. For me, probably the worst part is at the moment is that I cannot picture a face of any of those nurses that, they're taking care of me. All you see is just a pair of eyes and a distorted voice. And that's something, that I keep on thinking, who were they, I feel very, very weak, but I still feel that the body has been fighting the virus, and I feel, like I said, I haven't got the strength to do anything. I've been told it's going to take weeks or months. The only issue maybe it's my lungs that they need to expand. I feel I'm not ready yet. We take life for granted. We just go on with our own business. We don't think about these things. We just think, okay, well, one more statistic, but that number is a person, it's a human being. Don't be selfish and think about the others, because by going out, because you just want to go out, you're not helping. Help everyone. And that is my message out there. Please, stay home. If you don't have to go out, stay home. There's time for us to enjoy our life.
What we've seen is just a general reaction perhaps to the second dose a little bit more than the first dose, but bear in mind we're still early days. We only started vaccinating on the second dose on Sunday, so only 4 days ago. I suspect what's going on is that your immune system has now kicked in. You have antibodies, so when you give the second dose, the antibodies are reacting and being stimulated by that second dose, which is the whole point of boosting it up from the 70, 80, 90% up to as close as we can to proper immunity. So people have reported mainly kind of flu-like symptoms, muscle aches, headaches, feeling just a little bit under the weather for a couple of days. Where the vaccination site was a little bit more uncomfortable than it was during the first one. That's not inconsistent with a lot of vaccines which are 2 doses in fact. And those are just really simple measures. So Panadol, just keeping, just trying not to do any excessive exercise, taking lots of fluids, and just keeping well for a couple of days, and it just passes. So those are the only real reports we've had. And most of those are relatively minor, so it's really essentially anecdotal that people have just not felt as great with the second dose as the first.
But it should pass within 2-3 days.
Couple of days, yeah. And of course, if symptoms go on longer than that, or symptoms become worse and perhaps unexpected, most people expect to feel a little bit lousy after a vaccine. If it's a bit unexpected, a bit worried, then just call us and let us know. But it's definitely not a reason not to have the second dose. Absolutely not. Once you've had the first dose, complete it.
What I would like us to think about is group immunity. I am the doctor of the people of Gibraltar. For me, the group is the people of Gibraltar. So the question, if I reframe that a little bit, is how can we be assured that the people of Gibraltar are immune? And the only way to be assured of that is to get as much vaccination done as possible. Now, various people have done various mathematical modelling to suggest it could be 75, 85, 90%. But from my point of view, the more that we have vaccinated, the more likely we are to have our freedom. My aim, my vision, my hope is that I can advise government that on the basis of our own experience of how much virus there is and how much protection there is, and that means measuring people who've had the vaccine who then get infected, or are they carriers? We're going to have to differentiate the two. And if we can look at that over a period of time, my aim is by the summer, we might be much freer, very much freer than we are at the moment. I hope, my aspiration is we can have a normal summer. But so we have to go through a little bit more of hard work. It's not quite back to normal yet. But for those that have been vaccinated, you're at least essentially free of fear that something bad is going to happen. Because why? Even if you're not immune, you've got the hospital still open for you. It's not clogged up with lots of people demanding care or actually needing care. We've had some terrible experiences of people having harrowing experiences. It's not pleasant being in ICU. It's certainly not pleasant when you're prone and you're on a ventilator, and I know the staff members are exhausted, and I also asked for people to recognise the hard work they'd put in. It was easy to do in March, April, May, but actually the hard work has been done now. And again, I take my hat off. I congratulate and thank the hard work everyone's put in throughout the system. And I know we focus on the GHA, but actually there was hardship in all our essential and frontline services. Everyone's had to make significant changes. And again, I thank those people for protecting our elders. I know that we got it into the ERS, but actually a lot of people had to put up with self-isolation, close contact, even being positive, having family members that were positive. It's been a horrific and terrible time. We can see the light at the end of the tunnel.
At what point do you become eligible for the vaccine through the GHA? I'm thinking about cross-frontier workers, for example, in supermarkets, who I understand have not yet received their first dose, yet are 100% frontline, aren't they?
Absolutely.
What's the rationale there? So
this is all about balance of risk, really. It's not that we are saying that supermarket workers are essentially less important. Essentially, what we're doing is we're asking everybody to register online and to request a vaccine. But bear in mind, we have a little slight added nuance, which is that we can't guarantee the supply of our vaccines. So we're not in the UK where we can just have deliveries of as many vaccines as we need. We have to also use our vaccine supplies as they arrive from the UK via an RAF flight. And with the numbers of vaccines that we receive, the doses we receive, we have to calculate not only that we can give the first dose, but we will have enough either with us or coming to guarantee the second dose.
Given that the GHA has extended the vaccination program to students 16 to 20-somethings who are in a lower risk category than in terms of individual risk,
than the 40s to 50s. Am I right in assuming that you have assurances from the UK government of a plentiful supply, and you are confident that the 40s to 50s are also going to be vaccinated soon?
Yes, I think that the evidence so far speaks for itself. We've had a very good supply and we've had a very continuous supply. You know that next week we'll be starting to vaccinate school pupils between the ages of 16 and 18. The reason that we're doing that is because the risk of carrying and spreading the infection that they pose, both among themselves, also in relation to spreading it at school, as well as spreading it to other members of the family. And Gibraltar is very particular in the sense that there are a lot of families where we have intergenerational families living together in the household. So that was the rationale and the motivation for doing that. We'll start on Monday. We will have less, on the basis that all school children take up the offer, we will have less than 1,000 children who will have this. At the same time next week, we will also start calling people in their late 50s. So it's two programs that we will be doing in parallel. We are able to, at the moment, administer more vaccines than we were in the first in phase 1 of the program. Because our nurses have become more skilled at doing so, we are able to do more a day. That means that on average, the plan next week really primarily is to administer the second dose of vaccine to people who had it in phase 1. But because we're now able to do more a day, on average, we probably have an additional some 60 slots, I understand. Within that, it means that we do continue to go down the list. So if by the end of this week we're pretty confident that we will have vaccinated everyone up over the age of 60, then next week it's very likely that we will start calling people who are in their late 50s. So that is happening in parallel to the second dose and in parallel to the school pupils, who we think we will be able to vaccinate in the space of 3 days. By the time that they commence school, then they will probably have had a period of almost 2 weeks since they have had their first dose.
So, you know, the main discussion we've had today is about the vaccination campaign, and the vaccination is designed to stimulate your immune system to give you internally a protection against this particular virus. But your immune system is an incredibly complicated, very, very capable system, and it is designed to react to infections, and your immune system reacts to infections all day, every single day of your life, and it's very good at doing that. But we need to help it do that, and the fitter and healthier and stronger you are, the stronger your immune system is.
We're very happy with the way the programme's going at the moment. I think we're encouraged about the feedback as well we get from people that are vaccinated. They're very grateful to have received their vaccine. And I think we've got a couple of emails from the different essential services saying that it's actually given some hope and something to look forward to for their staff members going forward.
Certainly this is the time to give up smoking, because we know smoking makes your blood thicker anyway. And one of the lessons, the abiding lesson for all of this, is that what's been clear is that if you go into older age fit, you're less likely to suffer the consequences of this virus. Seems to go for those people who aren't as fit as they ought to be when they get to their 70. So if there ever was a motivation for people to be more physically active, to avoid all the intoxicants we love, and enjoy a better weight, this is it.
I'd just like to thank the public, obviously, for their uptake. Thank all essential care workers. They've been very enthusiastic, and they've helped us, obviously, to deliver the programme as well. So thank you very much.
I would really like to take this opportunity to thank every single member of staff who has been involved in the vaccination programme, whether it's been in the planning stage or the execution stage. Everyone has been working round the clock to make this the success that it is for Gibraltar. We have some 22 vaccinators in St Bernard's Hospital and at the former PCC, and they have been working non-stop. We also have a team of vaccinators at ERS. Delivering the vaccine to ERS residents is that little bit more complicated because we're talking about having to deal with elderly people, a lot of whom have dementia, and they have, I know, been very patient to be able to explain the procedure to the residents and also in the delivery of it. But all in all, I think that our vaccination program has been extremely successful, and credit to everyone in the GHA and everyone who's been involved in the process. And of course, we also have to thank the people who have taken the vaccine. We have had a tremendous uptake of the vaccine. It's been very well received. The percentage of people taking the vaccine is very high. And really that's what it is. Once again, it's about Gibraltar showing how we can work together for the benefit of everyone in the community. And I really hope that as we continue to offer the vaccine to the younger generations, that the take-up is just as high as it has been to everyone to whom we've offered it so far.
Operation Freedom has brought much needed protection to Gibraltar. We've heard tonight that it's moving quickly, with the hope being that enough of us will be vaccinated to keep the number of active cases down and as many as possible out of the hospital. The significant caveat to that is that this is dependent on the UK government continuing to deliver enough vaccines to the ROC. After a gruelling 11 months and the most deadly January in the past 100 years, those vaccines and the protection and hope that they represent can't arrive soon enough.